Continuing Healthcare Assessment, the Key Indicators, Part 3, Complexity. For reference, hi, I'm Sian, an adult social worker, and we're looking at why scoring low, moderate, high, severe or priority are not the only things that get looked at in an assessment. They also look at 4 key things: nature, intensity, complexity, and unpredictability of a person's needs. So let's discuss complexity. This looks at how a need present and interact with one or more other condition to increase the skill required to monitor the symptoms and treat the condition and/or manage the care. So the questions to ask here are there multiple needs interacting? And do they make care more difficult to manage? So for example, this is completely made up, a person X has a risk of seizures that is likely to lead to hospital admission. He has a learning disability, which means he struggles to communicate or be able to raise an alert when the signs of a seizure begins. He's unable to manage his own medication for this. Therefore, staff often can only respond once the physical signs of a seizure begin. Person X self-harms, and this is worsened during personal care, which takes a long time to complete at a good quality level. If they didn't spend the time doing this, there is a high risk of skin breakdown, infection, or injuries caused on his own skin. Person X has had a history of skin infections requiring regular care, topical pre-use to prevent the spread, with a current open wound which is grade 4 requiring daily district nurse visits to monitor and is not currently showing any signs of healing. So what we're doing here is differentiating that although you can score moderate or high or any other score in a particular need such as skin integrity, we're looking at how the 2 or more needs interact with each other, creating a higher skills level intervention being required. In the series is unpredictability, so please follow along if you find this helpful.